Now, coronavirus cases are gradually rising in Kent County, now totaling more than 35 people sick. Now, to get an update on just how the county is battling this virus, we are now joined by Dr. Nerly Bora, the medical director at the Kent County Health Department. Dr. Bora, thank you so much for joining us this morning.
Thank you.
Now, doctor, we've seen plenty of cases all around the country with hospitals struggling to get the medical professionals the equipment and protective gear they need to do their jobs. How are things going in Kent County?
So far, there are still limitations, but people are working hard to get the supplies that they need. We have not seen the high volumes in our hospitals compared to other parts of the country and other parts of the state. So right now, people are doing their best to conserve what they have.
Now, as the spread of the virus continues to grow, will the number of cases in Kent County, are they expected to rise significantly in the coming days as more tests are processed?
I think we could definitely see that.
And what's the availability on those tests? 'Cause I know a lot of people have been saying they can't get tests, they have symptoms, and they haven't been able to see a medical professional. What's the availability look like when it comes to those COVID-19 tests?
So right now, the supplies that are needed to run the tests are pretty limited. And so that is why all the hospital systems are really restricting their testing to those who are hospitalized and sick. And they have specific criteria for people who really can't get tested right now. As that changes in the future, there'll be more opportunity for people to get testing.
And what's your recommendation for people who may feel as if they are symptomatic?
I mean, right now, the best thing they can do is stay home and rest and hydrate until they start feeling better, so that they're not at risk of exposing other people or getting exposed from other people who may have the virus.
And when it comes to the quarantine situation, people self-isolating, and if they are feeling symptomatic, what's a safe, gray area or wiggle room for someone to reintegrate into society?
That's a good question. Right now, what we're saying is for people who, even if people have been diagnosed with COVID, we're saying that you need to wait 3 days until your fever has gone away, and that's without using medications like Tylenol or ibuprofen. Wait until your symptoms are getting better, and then wait until 7 days after your symptoms have started. After that time has passed, then it's safe for you to go back out.
Dr. Bora, thank you so much for joining us.
No, thank you for having me.